Hello, my name is Tracy Greco. I'm the newest board member of BUSNA, and I was diagnosed with Birdshot in 2013. Our next presenter is Sharon Graham. She is the regional administrator and staff director for the Centers for Medicare and Medicaid, located here in Philadelphia. She has an impressive career. You can check out our website. She's been with CMS since 1992. Sharon, I just want to thank you for your dedication in the advancement and in quality and services in our healthcare system. And also thank you for presenting here today. By the way, Sharon, my daughter Amanda, she also has a master's degree from Rutgers, so goes to Scarlet Knights. Yeah, so please welcome Sharon. I also just want to say that any Canadians that we have here, we have a breakout session outside, so because I guess Medicare and Medicaid is really United States, so you're welcome to go outside for the breakout session. Okay, please welcome Sharon. Thank you.
And I am well aware that I stand between you and the end of the day, I think. So, but I'm happy to take questions as well as we go through the presentation. I am very passionate about Medicare and about making sure that people understand what the benefit is and how they can best use it. And at the end, I do have some statistics that we worked out with our contractors around the coverage for birdshot diagnoses and related codes. So you'll see that at the end. I have to put this disclaimer on everything. It basically says that what you're about to hear is current as of today, because as we know, policies and things like that can change. So what is Medicare? Let me ask a question. Do people know Medicare, or how many people in the room are Medicare eligible? Oh, good. All right. So from this perspective, I hope you had a great experience with your Medicare so far. I'm happy to answer any questions that you might have specifically about Medicare experiences that you've had as well, because I do believe that in asking the questions, everybody gets to benefit. So Medicare is primarily for people age 65 and over. And I say primarily because there are people who are deemed to be disabled by Social Security who are under age 65 and can qualify for Medicare. But I stress that, again, this is people who Social Security deems disabled. It's not workers' compensation or anything like that. So it's an application process through Social Security, and then you need to be on Social Security disability for 24 months before your Medicare kicks in. And then lastly, people who have end-stage renal disease can also qualify for Medicare coverage for 36 months through their transplant period. And as it notes there, you do have to be a U.S. citizen. So just real quickly, there are a couple agencies responsible for Medicare, and all four of them are here on the screen. It just depends on where you are in the process. I'm in the bottom right corner there, the Centers for Medicare and Medicaid Services, but you actually get your start with Medicare by going to the Social Security Administration, and that's where people often get confused. But Social Security handles the initial application for Medicare. And the reason for that is because they have your tax records, and Medicare is fed by your taxable income that they pull in from the IRS typically. They can review any of your disabled histories, your tax histories for premium payments and things like that. So you go to Social Security first to apply for Medicare, and once you're approved for Medicare, then your record transfers over to our agency and we take it from there. For people who work for Amtrak, say, or Conrail, they get their Medicare. They still have Medicare. It's just administered instead of by CMS through the Railroad Retirement Board. And for people who are federal retirees, you also have access to Medicare, but there's a component that is also managed by the Office of Personnel Management. So there are three parts to Medicare. Well, really there's four. We'll talk about the fourth. That's somewhat optional, it's voluntary. But the key parts are the ones you see here, and I'll talk about them more in depth. It's Medicare Part A, which is your hospital insurance. Part B is medical, and Part D is your drug coverage. And for Medicare Part A, it's four, we call it hospital insurance, but it includes not only hospital, but also if you happen to need rehab, so skilled nursing care, home health, or hospice care. Medicare Part B is basically everything else. It's your outpatient services, labs, durable medical equipment, x-rays, MRIs, physician visits, of course, are covered under Medicare Part B. And Part D, it's always easiest to remember that D stands for drugs. The letter that's missing is Part C. That's our Medicare Advantage program. We'll also talk about that as well. And the C just works alphabetically, but it used to also be known as the Medicare Plus Choice, and that's where the C kind of came from. So what is original Medicare, and then what is Medicare Advantage, which is the Part C? What happens is when you become eligible for Medicare, everybody goes into original Medicare, so what you see there on the left. And with original Medicare, you get Medicare Part A, Medicare Part B, Part D is optional, and what our agency does is we contract with private companies to administer that benefit. We pay for it, but private companies administer that. So it's voluntary on your part, if you have original Medicare, to get your drug coverage separately through a standalone prescription drug plan, we call it, or PDP. Now, as we go through some of these other slides, you'll see that Medicare is not 100% coverage. There's out-of-pocket costs, deductibles, and coinsurance. So many people who elect to keep original Medicare purchase what's called a Medicare supplement that you see there on the bottom, sometimes known as a Medigap. You might also know it by Medigap plans. And what those plans do is they're also offered by private insurance companies that are licensed through the state, and they fill in those out-of-pocket gaps for Medicare. That's why we call them gaps. And you'll see on a future slide what some of those out-of-pocket costs could be with original Medicare. Now, you can choose to get your Medicare benefits through a Medicare Advantage plan, what you see on the right side there. And they are required to cover everything that Medicare covers. So as you see with the check boxes there, you'll get Medicare Part A and Part B. Most of those plans will also include Part D as just a package there. So it's kind of like a one-stop shopping. You don't have to sign up separately for Part D. They do often offer extra benefits, and we're no longer in what we call our Medicare Advantage open enrollment season, or even just general open enrollment season. But if you're on Medicare, I think if you're just watching television, you see the advertisements: Humana, United, Aetna. Those are the Medicare Advantage plans. So those are Medicare Part C, but again, you have to sign up for those plans, and they do cover everything that original Medicare covers. And I'll talk some more about the limitations that you might face in a Medicare Advantage plan. So there's a group of people, primarily people who are already on Social Security. So remember, if you're familiar with Social Security, you can elect Social Security as early as age 62. And if you're disabled, of course, even earlier, you'll have Social Security disability. So Social Security knows who you are. And remember that I said you are enrolling initially through Social Security. So when Social Security sees your 65th birthday coming up, several months ahead of that, they will send you what we call a Welcome to Medicare kit. And so that will include typically your Medicare card that shows your Medicare A and B eligibility and some other informational material that's there. And all you in essence have to do is sign the form that comes with that and return that to Social Security, and your Medicare will become effective. And again, it says here the Welcome to Medicare package. So this 3 months is really important because for people who aren't automatically enrolled, there's a window that we'll talk about that's 3 months before your birthday where you can sign up also. But if you are already receiving Social Security, your Medicare information will come to you automatically. But for people who have to sign up for Medicare, as you can see, you do so with starting the 3 months before your 65th birthday, and you do that again through Social Security, and you can do the same thing through the Railroad Retirement Board. And we're going to talk about some exceptions to that. But when you get your Medicare, you'll have this particular card. And I just want to point out that, as I click through this, the Medicare number there in this instance is 1EG4. For people who remember Medicare, back when those cards used to carry your Social Security number, that was a huge fraud risk, as I'm sure you can imagine. So in the last 5 years or so, we switched everybody over to this, what we call MBI, your Master Beneficiary Identifier. And so this is a unique number, as was your Social Security number, of course, but as you can see, it's much more kind of like an encrypted. But we always encourage people to not share your Medicare information with anybody. Your doctors, obviously, but nobody else than that. Keep your Medicare card close. Medicare, my agency, does not call you. We do not do cold calls or anything like that. There's a lot of fraud that runs rampant out there with people calling saying, hey, I can get you a free wheelchair. I can get you some of that free durable medical equipment that you just heard about in the prior presentation. Just give me your Medicare number. Do not do that. Please do not share your Medicare number with anybody over the phone, only your providers and your other support staff. So again, if you are getting Medicare through the Social Security packet, the 3 months before, as where I mentioned, you just kind of keep your card, you sign something that you send back to Social Security, and that triggers your Medicare that is typically going to be effective the first day of your birthday month. So today, if your birthday is in April, you would have seen that your Medicare card will be effective April 1 of 2024. Ooh, okay, thank you. And so if you need a replacement card, this number is so important, 1-800-MEDICARE. Easy to remember. You can do so much more at 1-800-MEDICARE than simply get a replacement card. We have accessibility 24 hours a day, 7 days a week, and also availability in about 200 different languages. And we also have a TTY number that you see there as well. So we try to really make sure that people know they can get universal support for just your regular Medicare questions, but also during open enrollment season to sign up for plans too. We just have a great resource there for people to be aware of. So there's a couple options. If you are not if you're age 65, but you don't yet need your Medicare, and you're typically, that's going to be a person who, whether they themselves continue to remain employed or perhaps their spouse is employed and they're getting coverage through the spouse's health insurance, you don't need Medicare at age 65 because you still have acceptable or what we call creditable coverage. So for those people, they don't have to go to Social Security because they currently still have health insurance. They can wait to sign up for Medicare Part A and Part B. So when that point comes that a person does need now, there's typically it's going to be retirement, but there might be some other instances as well. But typically around retirement, when you're going to lose employer coverage, you need now to go to Social Security to sign up for Medicare. And so what you're going to do there is there's something called the initial enrollment period. Let me take a step back. So and I just want to finish the example first about if you're losing your retiree coverage. That's actually the second bullet, the special enrollment period. If you're losing retiree coverage, you've worked till say 67 or 68 and your spouse has, you need to sign up for Medicare in this special enrollment window that's 8 months after your retirement date. And that does not include COBRA coverage. So if your retirement date is April 30th, you'll have basically December 31st is the last day of your special enrollment period to sign up for Medicare. Your initial enrollment period, if you're signing up for Medicare, but again, Social Security doesn't quite know about you yet, your initial enrollment period is going to be a 7-month window that basically will surround your 65th birthday. So it'll be your birthday month, let's say it's April right now, 3 months before, March, February, January 1, and then going out another 3 months. So it'll be May, June, and July. So for someone whose initial enrollment period is April, they have basically from January 1 through July 31st to sign up for Medicare. And then lastly is the general enrollment period. Some people they might think they don't need Medicare. They decide for whatever reason to delay Medicare, but didn't otherwise have the creditable health insurance coverage. Those people are limited to signing up for Medicare only during the general enrollment period. And that period is only January 1st through March 31st of every year. And then your coverage will be effective the first day of the next month. So if you sign up January 22nd, it'll be effective February 1st. What's important to know is that if you wait to sign up until your general enrollment period, an enrollment penalty will apply. And that's why these enrollment periods are so very important. The penalty itself is 10% of the Medicare Part B premium for every 12 months that you could have had Medicare but chose not to. So I was actually just talking to a person recently, 77 years old. She basically should have signed up at age 67. That's when she stopped working. So that's 10 years that 12-month periods, I should say, because it's kind of like a rolling calendar. It's not a calendar year. But it's every 12 months that she could have had. In essence, 10 years times, you'll see the Medicare Part B premium right now is $175. And but multiply, say, that by 10, that's an added to your premium, and you pay that for your lifetime. So that's why it's so important to sign up for your Medicare Part B when you're first eligible and not delay. So if you already have Medicare, we have what's called our open enrollment period, and that's October 15th through December 7th of every year. And that really affects people who are in Medicare Advantage plans or want to enroll in a Medicare Advantage plan. If you have original Medicare and you're satisfied with it, you don't want to make any changes, you don't need to do anything during the open enrollment period. But during that window, again, October 15th through December 7th, that's when people can enroll in a Medicare Advantage plan or maybe change their Medicare Advantage plan. If you have original Medicare and a standalone prescription drug plan, this is also that point where you could change your prescription drug plan as well. It's interesting, we don't find that very many people do that, but on the Medicare Advantage side, yeah, a lot of people do use that opportunity, and that's why you see that really heavy advertising on the television, radios, in your mailbox, I'm sure. You'll just see a lot of that during that open enrollment period. The Medicare Advantage open enrollment period actually mirrors the general enrollment period. It's January 1 through March 31st. And for people with Medicare Advantage plans, maybe it's the first time and they realize, hey, I didn't think this is what I wanted to do. You can make a change during that window. So you can go back to original Medicare, or you may decide you want to go to a different Medicare Advantage plan. But you have one opportunity during that Medicare Advantage open enrollment period to change your Medicare Advantage plan. And for people who are institutionalized primarily in a nursing home, we don't find that this is a benefit that's often taken advantage of, but people in institutions have an extended window, in essence, to change a plan that they may have signed up for.
If you have
Oh, yeah.
credible insurance,
Mm-hmm.
you're over the age of 65, you're still working,
Mm-hmm.
do you pay that Medicare penalty?
No, because if you have creditable coverage, right, you're still working, you continue that coverage. Probably Social Security doesn't know about you because you're not getting a benefit, so you wait until your retirement to sign up for Medicare. But that's why I was saying it's so important, don't really wait beyond that. You have that 8-month window from your retirement date. But then a penalty wouldn't kick in or wouldn't start to calculate until the end of that 8th month.
I have some patients who find it incredibly frustrating, and it's just frustrating for us as well in the office. They have private insurance, they have Medicare, and they're told you can't come in because Medicare is saying, we don't pay for this, and the private insurance says, well, we don't pay for it. So they do this. The patient has double insurance, and they can't get in with coverage. Do you know what causes that?
No, I don't know. Unless the private insurance, well, a Medigap plan will not pay unless Medicare pays first. So that may be the trigger there. Like a private insurance, an employer, that wouldn't have an effect on Medicare's coverage, but that may be, hey, listen, we're your supplement and we're not going to pay unless Medicare pays. Now, as you'll see in my last slide, Medicare covers has covered 97% of the top 6 codes for people with a Birdshot diagnosis. So that's a rare occurrence, I would hope, but I can give you my contact. And, okay, yeah, I was just looking at Birdshot. Yeah.
It's surprisingly common.
That's interesting because Medicare also doesn't do pre-authorizations. Typically, Medicare will allow you to self, 99% of all providers and hospitals participate with Medicare, and you can self-refer, which is a difference from Medicare Advantage also. We're going to talk more about that too. Okay, I have a question here and then there. Go ahead.
Okay, I don't know how it is in Pennsylvania, but in New York, we're involved in a very, very big lawsuit. We had like top lawyers. I belong to the New York City Organization of Public Service Retirees for the benefit preservation. We want to keep original Medicare. Medicare Advantage, in our estimation, and I don't know how it is in Pennsylvania, is horrible. You need pre-authorization, and like some girl who's not qualified in any way is the one that makes that decision. It's horrible, horrible, horrible. I'm paying like $50 a month for the lawyers to support this, and we're winning left and right and left and right. Mayor Adams wants to, because of course the city wants to save money.
Right.
And they save a lot of money with Medicare Advantage because they refuse everything. Where with the regular Medicare, and I have Medicare and Emblem Health, and as this gentleman, the doctor just said, why things are refused, it's because, as you said, Medicare has to approve it first. If they don't, you can't get it. But usually if Medicare approves it, then I get paid for both. I get the Medicare, and then I get my copay, which they had also switched that, where they were charging us a copay, but we also went to court about that, and we got that wiped. So now I have Emblem Health. My husband's a retired lieutenant in the NYPD. So this is for federal workers like teachers, firemen, and policemen.
Right, and that's offered as a retirement benefit through your employer, just
Right,
like
exactly.
OPM does
But
for
we're
federal
just fighting
employees,
like hell, I mean, to stay away from Medicare Advantage.
And we'll talk more about Medicare Advantage. Some people will find it beneficial for reasons that I'll describe, but then we'll also talk about some of the buyer beware pieces of it too. Yeah, I agree. And I'm familiar with that case, yeah. Go ahead, sir, you had a question?
I just want to make sure I understand. If you're approaching your 65th birthday, you're gainfully employed, you have insurance, the government will find you and give you this announcement that you're eligible to sign up. But if you don't need it, you don't sign up.
Right.
How do they know you don't need it? I mean, they leave you alone until you give them the honor system that I am now
No, you have to
retired?
prove it.
Well, they'll go back. So Social Security has your record. So you know how you get the that shows all your income through all these years?
You can defer indefinitely and then
If you have, you will have to prove at the point in which so typically, employers will give you when you retire a statement of creditable coverage. So that's what you take to Social Security, that you're age 68, you continued to work and have health insurance through your active employment. And that's your proof to Social Security that you have been gainfully employed, getting your insurance through another source, and therefore a penalty would not apply when you signed up at age 68. Yeah. Mhm. Yes, sorry.
If you're on an Advantage, can you only change once, or can you change every year?
Every year. Yeah.
Okay, that's what
Once you've selected a plan, a Medicare Advantage plan during the open enrollment season, it's effective January 1st. You have that plan all year unless you make that change during this Medicare open enrollment season, that first 3 months, but then you have it all year until the next year. Yeah, there's really very limited situations when you can change that. For example, if you move, you can change your Medicare Advantage plan.
They are, I don't know about how it is here, but in New York, they're trying to push the Medicare Advantage on us.
Well-
We're fighting, but they're pushing it on us.
No, Medicare Advantage is a choice. Now, you're a former employer, this employer coverage that you're talking about is pushing it, and that's a whole separate issue because that involves a former employer. Medicare Advantage is a choice that is heavily marketed, yes, but no one is required to enroll in Medicare Advantage. But when we talk about the benefits, you'll see some people are very attracted by the additional benefits and the lower cost. Yeah, and I'll talk about that a little bit more too. All right, so we already talked about the initial enrollment period. I got a little bit ahead of myself, but you can see you've got your birthday months and the 3 months before and the 3 months after. And so that's, again, in your situation that you were just describing, sir, you had employer coverage, but some people, they don't have employer coverage. Their spouse maybe, yeah, okay, so I don't want to belabor the point unnecessarily. This is a special enrollment period for people who are employed. You have to look at your retirement month and then 8 months after that. And again, you go to Social Security. Your employer should be giving you some form, a letter. It's not a template letter or anything, but some statement about your creditable health insurance coverage. Social Security is checking your records, approves your enrollment, and it'll be effective at any point during that 8-month period, depending on when you went in to apply. And then this general enrollment period, again, we talked about that, the first 3 months of the year if you miss your other enrollment opportunities. Okay, so let's talk a little bit more about what Medicare Part A covers. So you can see here, and I mentioned it briefly, so it's covering, we call it hospital insurance because that's the big one. It covers hospitalization, and it covers all of those green checks that you see in a hospital room. It also covers care in a skilled nursing facility. That is not like your custodial care in nursing home. This is when you need rehabilitation services in a skilled nursing facility. Most people do not pay a premium for Medicare Part A because you've paid your FICA taxes for at least 10 years. And even if you didn't, say in a spousal situation where someone didn't work, you can typically still get Medicare on the spouse's record. And there are children who get Medicare on their parents' records. There's a lot of different iterations in which you can become eligible for Medicare. Oh, there's the FICA taxes. What I want to really call out, though, is the importance of this 10% penalty. I mentioned Part B because over 90% of people get premium-free Part A, but there is also that penalty if you do sign up for Medicare Part A and have to pay a premium of some sort. There will also be a penalty if you delay that. People who don't have the 10 years or what we call 40 quarters of coverage can still sign up for Medicare Part A. There's just an associated premium with it depending on how many quarters of coverage you have. And again, Social Security will have those records based on your work history. Now here's these out-of-pocket costs, and this is what I was mentioning why a lot of people choose Medigap, because you can see that every time you go into the hospital, pretty much it's this is for 2024, it changes every year, but $1,632 out of pocket when you go into the hospital. Now, if you go into the hospital and are discharged and go back in within 60 days, you don't have to pay this deductible again. But if you're out of the hospital for more than 60 days, you start what we call a new benefit period and the deductible applies again. So it can add up if you're in and out of the hospital, and this is why a lot of people pick up Medigap plans, which I'll talk about some more. And then you can see Medicare covers up to 150 days when you add in your lifetime benefit or your lifetime reserve days, but depending on how long you might be in the hospital, there are additional co-insurances that could apply. The inpatient mental health benefit is exactly the same from a parity perspective, so those dollars don't change. And here you can see if you're in a skilled nursing facility, you don't pay anything for the first 20 days, but then there is coinsurance that applies up to day 100, and Medicare doesn't cover you after day 100 for that particular stay. If you go in for a different reason, a new benefit period would start for skilled nursing care, but within that one admission to a SNF, as we say, it's up to 100 days. Home health care is typically 0 for some and then 20% coinsurance because that is usually an outpatient type benefit, so there's a 20% coinsurance. You can see hospice is 0, and then we do have the blood benefit that's covered under Part A. It's not a highly utilized benefit, but you can see there's typically nothing there's no co-insurance for the first 3 units of blood. Now, considering signing up for Medicare Part A, as I mentioned, it's free for most people. So even if you continue to work, when you turn 65, Social Security may find you and you can still keep your Medicare Part A. That's totally great, right? Because now you've got your employer coverage and you've got Part A. It's free. Why not take it? But again, that's totally up to you. You can decline Part A if you wanted to. You want to consider your work history, of course, but most people, again, would have a strong enough work history to have premium-free Part A. And if you do have a benefits counselor, if you're fortunate enough to be with an employer organization that offers that through their HR department, please speak with them about coordinating especially your retirement date and signing up for Medicare, because we find that a lot of HR representatives are very familiar. They're very familiar with your employer benefits, but they're becoming increasingly familiar with the best ways to sign up for Medicare to make sure that you don't have any breaks in coverage, and that's what's really important. So Medicare Part B, remember Part A is pretty much your inpatient side. You'll see a whole list of services here that Medicare Part B covers. I won't read them all out to you. There's also a ton of preventive services, and we always like to highlight this for people because we want you to stay healthy. And for Medicare Part B preventive services, there is typically going to be no copayment. So there's no reason for you to not get a bone mass measurement if your primary care doctor recommends that, for example. Medicare preventive services have a $0 copay. The premium, as I mentioned before, there is not a premium for Part A, there is a premium for Part B. So when you sign up and your Part B is effective, it's a premium of $174.70 a month. People can pay it a number of ways. Some people write a check, some people get it taken right directly out of their Social Security. That's the largest number of people typically will do that rather than pay a check. Some people choose a direct deduction from their own bank account. So there's a couple of options, and you'll make your choice when you sign up with Social Security. Some people do pay less. It's this hold harmless provision, but that's a very small percentage of people. Most people are going to pay this year the $174, unless, of course, they've got a penalty that applies, or in the instance where you have a higher income. And we call that the IRMA, or the Income-Related Medicare Adjustment Amount. And this slide is really important because especially the IRMA is the IRMA is determined based on your tax records of 2 years prior because of the way that the IRS works and the calendar years and things like that. So, I did it again, I'm sorry. Can you go back a slide? Because this slide is really important. Can I do that? I can do it myself. Okay, good. I'm always afraid to touch buttons because you just never know what you're going to do. So you can see here you've got the income tax return individually or joint, and then the dollar amounts here. But if you continue to work, your income is obviously going to be higher. But remember, let's say you're age 67 and you retire, Social Security is going to look and see what your income was in the 2 years prior when you were working. There may be a chance that your income exceeds that amount, and you can see there what the adjusted premiums are. Now, this also changes every year because Social Security will look again to your next year's tax return. And then finally, at some point, your income might drop to the point where your premium goes back to $174. But if your premium falls within those bands that you see there in the far right column, you can see the IRMA, that's a Medicare Part B premium that you would pay in those income brackets. And I think my slides can be shared after this too and posted somewhere, so this will be available to you if you'd like to see that.
Is that based on gross income or net income?
It's your adjusted gross income. Mm-hmm. Yeah, good question. Okay, so now, remember, go ahead, yeah.
If you don't mind, the $174 is based on your income, not from the last year, but from 2 years prior?
Right, exactly. Mm-hmm.
Okay.
Yeah.
And that's base, that's for everybody.
Mm-hmm.
And then that changes, and we go up to the next 2 years and the next 2 years?
Yeah, it's like a rolling 2 years, and Social Security, then they get your tax records to make the determination. And so they'll adjust. You can always appeal it, by the way, too, through Social Security if you feel that they're not using the right income amount. But they adjust that automatically every year when they get the feed, the IT feed from the IRS with your updated income amounts.
Thank you.
Yeah, you're welcome. So you saw the deductibles and the coinsurance and things for Medicare Part A. Medicare Part B also has out-of-pocket costs and cost sharing as well. So there is a one-time yearly deductible of $240 in 2024. Again, it's adjusted every year. And then you'll see for Medicare Part B, you're typically going to pay 20%. Medicare pays 80%, you pay 20%. So those out-of-pocket costs, they can add up depending on the amount of services you receive, and that's why people choose to purchase Medigap plans, which I'll talk about in a bit. So just so you know, Medicare is great coverage, it's not universal coverage. So here you'll see some of the things that Medicare doesn't cover. Medicare Advantage plans do cover most of these things, which is one of the things that makes them very attractive, the Medicare Advantage plan. So you're not going to get routine dental care from original Medicare. And again, you can see all of the different options. These are some of the high utilized services by seniors that Medicare does not cover. From a vision perspective, we cover glasses following cataract surgery, but we don't cover routine vision care. Dentures, cosmetic, massage therapy, I don't need to read the whole list for you there. Again, Medicare Advantage. So do you want to sign up for Medicare Part B? This is an individual choice, and we have, myself included, but we also have counselors throughout every single state. We call them SHIP counselors, who are happy to do one-on-one sessions with people to walk them through the choices that you need to make about signing up for Medicare. Again, you're going to pay a premium for Medicare Part B, but if you don't have Medicare Part B, what do you have that's paying for those those outpatient costs, which is most of the services that we're going to be getting, doctors primarily, but also you saw the list of services there. That's covered by Medicare Part B. Again, I noted you can enroll if you do have creditable coverage. If you or your spouse continues to work, you don't need Medicare Part B at that particular time. Some people choose to pick up Medicare even though they continue to work, and the primary reason for that is because while you're still working, your employer coverage will be primary, but Medicare will be secondary and will pay, in most instances, your out-of-pocket costs that your primary insurance doesn't cover. So Medicare can act as a supplement in that particular instance. Do you have a question? Or if please feel free to ask me. It didn't get the last. Oh, no, sorry. I'm going to go backwards again. And again, if you continue to work, just remember that 8-month window. I will say that confuses a lot of people, and what also confuses a lot of people is that Social Security and Medicare used to be tied together at age 65, and now we know like full Social Security eligibility is now like 66, 67, depending on how old you are. And some people are eligible for Medicare at age 65, but they're just thinking Social Security age 67. And they end up waiting that 2 years when they could have otherwise had Medicare and didn't. And then again, you're in that general enrollment period, and there's a potential that penalties will apply. Okay. So there are a couple instances when you need to have Medicare Part A and Part B to buy a supplement. Again, that supplement that we'll talk about fills in the gaps, so you need to have Medicare Part A and Part B for a supplement to truly work. If you want to join a Medicare Advantage plan, you need to have Medicare Part A and Part B. TRICARE for Life is just for veterans, but you're required to have Medicare Part A and B. CHAMFA also for veterans, you need to have Medicare A and B. And for certain employers, if you're in a small employer, you will need to pick up Medicare Part B if that employer has 20 or less employees. And that's a federal law, actually, not one from the employer. So let's talk about Medigap plans. They are also sold by private insurance companies that are authorized or approved by individual states. Now, every Medigap plan, they're in letters, if you're familiar with them, A through M now, I think. And every one of those letters covers exactly the same benefits, regardless of whether you go to Blue Cross Blue Shield or Aetna or any other Medigap provider. But what will vary is the premium. So that's why it's important to look. AARP offers a really popular one also. And so the premiums will vary, but the benefits they cover stay the same because the benefits are federally prescribed, whereas, of course, the premium is all based on that insurer's experience. As I said, it fills in the gaps. So again, deductibles and coinsurance, and some of them do have some extra benefits. They are standard, as I mentioned. They do vary in cost. Very few states offer this special option called Select. I think it's Minnesota maybe, and one other out in the Midwest. So if anybody is here from one of those states, I'm happy to talk with you about that offline. None are available in Region 3, which are the states that I cover, so I'm not as familiar with those. Oh, and then you've got Minnesota, Massachusetts, and Wisconsin. Those are actually the Select states. So if you're interested in Medigap Select, we can talk about that if you're from one of those 3 states. So do you need a Medigap plan? So here's the thing, Medigap plans can be expensive, a couple $100s a month. Again, it's going to depend on the plan you're looking at and the benefits that they cover. But they can be costly. The beauty of it, in a way, is that once you buy one, you're typically not going to have any out-of-pocket costs. But again, you're paying the premium. It only works with original Medicare. Medicare Advantage plans also have out-of-pocket costs that a Medicare supplement will not cover. So when you talk to a Medicare Advantage plan and they've got a $20 copay for a primary and $35 for a specialist, those are your out-of-pocket costs that cannot be picked up by a supplement. If you're fortunate, as you do here in New York, to have a primary or to have a former employer covering you for your retiree benefits, then you do not need to pick up a Medigap plan if your former employer is offering you retiree coverage. That will act as your supplement. If you go to a lot of doctors and maybe have hospitalizations as well, and you saw a lot of the out-of-pocket costs, it might actually be more advantageous to sign up for a Medigap plan to help you pay for those costs. When you look at the monthly premium compared to several visits to a doctor, that might cost a couple $100, so you're paying $50, $60, $70 each time you go, that can add up too. So you want to consider those costs as well. And then monthly Medigap plans do vary, and they also vary by state. So if you looked at a Blue Cross Blue Shield plan in Pennsylvania, Plan C, let's say it's $200 a month. In Delaware, it might be just $150. So again, they do change. And their premiums change every single year based on rate filings that they have with the states. So the best time to buy a Medigap plan really is you want to purchase that along with your original Medicare, because at that particular point, you're in this open enrollment period, Medigap open enrollment period, they cannot health screen you. But if you do not sign up for a Medigap plan during that window, and you say sign up 5, 6, 7 years from now because maybe you're not having a lot of out-of-pocket costs, it's okay. But then they might health screen you, and they can also age rate you. It's important when you're looking at the plans to ask that question. Not every Medigap plan bases their premium on your age or your current health status. Some are community rated, which means they put all of their enrollees in the pot, into the pot, they stir it up, and they come up with one premium. Typically, community rated plans are more expensive earlier on, but less expensive if you stay with that plan, because the premium every year kind of gets re-stirred up and recalculated, and it's not based on you and your age and your potential health status. So when they look at just you, they can charge you more depending on, again, where you're at. So that's also important to look at as well when you're looking at Medigap plans. During this open enrollment, as I was saying, they can't health screen you and they can't refuse to sign you up. Let's talk about Part D real quickly. So again, this is D for prescription drug coverage. If you have a Medicare Advantage plan, it's typically included. If you have original Medicare doesn't cover prescription drugs. You have to sign up for it through a Part D plan. You can do that when you're first eligible for Medicare, or as we touched on briefly before, during the open enrollment period. And that's also when you can change. And it's really important to always think about your general healthcare coverage during the open enrollment season, because I always say plans change, your situation changes, out-of-pocket costs change, and in the case of prescription drug plans, the formulary changes too. If you're familiar with that, drugs are basically, they're tiered by these prescription drug plans, and the generics are typically the least expensive, and then there's usually 3 or 4 tiers that increase in out-of-pocket costs depending on the particular drug. And the prescription drug plans can move drugs around in those tiers every year, which can really increase your out-of-pocket costs if you're not paying attention. So that's always a really good time to look at your Part D plan and decide if you need to change. So again, as I mentioned, it is optional though. You don't have to sign up for a Part D plan. Like Medicare Part B though, there's a penalty if you decide to sign up later. It's a smaller penalty. It's 1% a month for every month you could have signed up but didn't. And that 1% is based on what we call the benchmark plan, which this year is about $32. So 1% is 32 cents. Did I do that math right? But times 12, and then you, again, like with Part B, you carry that for life. So again, like your car insurance, we want everybody to have insurance when they're first eligible. So the premium is there, or the premium penalty there is in a way to encourage you to sign up when you're first eligible, so that the penalty won't apply later down the road. As I mentioned, plans have formularies, so it's important that when you sign up for a Part D plan that you make sure that your drugs are on their formulary and what the out-of-pocket costs are. I'll put in a plug now for our website, which is Medicare.gov. Like 1-800-Medicare is easy to remember. Medicare.gov is a great place to go at any point but especially during the open enrollment season where you can plug in your prescriptions and you can even put in the dosages and you can see what Part D plans or what Medicare Advantage plans are available in your area and what the coverage is and what your out-of-pocket costs are going to be, because the plans give us that information every year and we load it onto our website. So you can really, at a quick glance, if you take the time to enter that level of detail, see what your out-of-pocket costs will be for those particular plans. We have a program called Extra Help for people of limited income and resources. That's actually managed by the Social Security Administration. So if you are of limited income means and limited resources, Social Security can help you apply for Extra Help, which brings down, often to zero, the cost of your prescription drug plan and also reduces your out-of-pocket costs to less than $10 for both generics and brand name drugs. So now we want to talk more about Medicare Advantage. So Medicare Advantage, as you probably recognize what's on the left here, has to cover everything that original Medicare covers. And they often cover more. I think the next slide talks about some of the things they cover: hearing, vision, transportation, dental. Some cover your part, they'll give you a refund on your Part B premium. Some of these enhanced benefits have really made the plans attractive, and they often are a $0 premium. So when you're looking at, say, $200 a month to keep original Medicare and buy a supplement, and you're looking at original Medicare and going, yeah, but this doesn't cost me anything, and I get all these great benefits. Okay, so I pay $20 or $30 when I go to the doctor. Do pay attention to the out-of-pocket costs. They might charge you for hospitalization. They might charge you for labs. Think about the services that you receive most to see what the Medicare Advantage plan is charging, because you will have to bear that cost 100% yourself. But as you were noting here, the Medicare Advantage plans are managing. They're called managed care plans for a reason. They are going to require prior authorization, for example, for the services that you receive. Or they might require referrals if you're in a true HMO. Sometimes they have preferred provider organizations where you can refer yourself. You typically can only go out of network if it's an emergency. So if you live in Philadelphia, those plans will have a network of doctors and hospitals here in Philadelphia. Make sure, if you're looking at this, that your doctor and your preferred hospitals, maybe it's even a lab, that they are in the plan's network, because you have to stay in the plan's network and get even referrals oftentimes to go to specialists. So that is just so very important to look at. And they do have more stringent requirements around prior authorization. And so they may, for example, before you get a knee replacement, require that you go through weight management or do physical therapy or try a prescription drug regimen. Whereas under original Medicare, if your doctor says you need a knee transplant, you are going to get a knee transplant. You don't need to go through those particular steps. Medicare is not going to pre-authorize. My mom likes to say that when she has original Medicare, she can literally go across the hall to the lab and come back and they'll have her results, and that's great. Whereas if you're in a Medicare Advantage plan, you may have to go down the street and around the corner to the Quest, because Quest is the one that participates with the Medicare Advantage plan and not the lab across the hallway. So it's kind of like those things. And so you really need to pay attention with a Medicare Advantage plan. They are great for a lot of reasons. For people of a limited income with, a $0 premium, and the extra benefits are terrific. The transportation benefit for people who don't drive is often an attraction for people. But just know that you're giving up a lot of freedom of choice when you enroll in a Medicare Advantage plan. Okay, but they can be really good for some people.
We have gone through, and I have an Advantage plan, but the their meds are so expensive.
The Medicare Advantage plan.
I have the Advantage plan.
Mm-hmm.
She's got the supplemental.
Okay.
And because, and we looked at it, and it's because the drugs are just so darn expensive, and Humira and everything else, and you have to look at what the deductibles are. And I don't know what anyone else has found, but I don't think the Advantage plan would get her the same type of drug for the same type of money.
Mm-hmm.
It's that whole rabbit hole and catastrophic and other things.
Mm-hmm.
I mean, do those formulas work on the Advantage plan with the catastrophic and other things as well?
Mm-hmm. They have to follow the same Part D requirements that we have under original Medicare, but they can do it actuarially different. They have to cover this. I know. Oh, I'm sorry, I did it again. They can be different by every plan. That's why it's so important. And you're a great example. Medicare is individual. So what works for the one spouse may not work for another. So you do need to look at the cost, what you need in terms of your coverage, because your health care is independent also. So that's it. And you've split your coverage for probably really good reasons. Exactly that, the out-of-pocket costs. Yeah. So, but what I would say is a Medicare Advantage plan, make sure that you're advocating for yourself all the time. You know, there are always appeal processes. If you get denied, there's even expedited appeal processes that they have to turn around in 72 hours, for example.
Another thing is, a lot of the doctors don't want to take advantage, but that's another.
Yeah, that's why we have networks of doctors. So Medicare Advantage plans contract with doctors, and you need to stay with that network. In Original Medicare, like well over 95% of doctors and hospitals contract with Original Medicare.
My point is you really have to look at it, you have to do the math.
Yeah, you really do.
You have to look at the math on these things, because it's not always.
Right, exactly. And the benefits, the formularies, I shouldn't say benefits, because the Medicare Advantage benefits have to be the same. If Medicare covers a knee transplant, you're going to get one whether you're in a Medicare Advantage plan or not. But the requirements around it can change and will change. And the drug side too.
The drug side of it is what is
Mm-hmm.
You realize you might be saving money now. I work in a skilled nursing facility. We get you in under Medicare. We can keep you the 60 days or whatever you need to rehab. You're out of there in a few days. They deny you. After a few days, you can appeal. I don't know, maybe 40% when their appeals, and off you go. You were not ready to go home, but I'm sending you home.
Mm-hmm.
And so you may save money now, but they pay the price later, and we can flip you in a nursing home anytime throughout the year, 12 months a year. We can flip you back to original Medicare, but it's not effective till day one of the next month.
Mm-hmm.
Are you talking about Advantage versus
Yeah,
supplemental?
Yeah.
If you come into my nursing home on the 10th of May and you need extensive therapy and they deny you on the 20th of May, you know, you either have to go home or pay the out-of-pocket cost, or if you can hang out for, you know, so many days, we can transfer you back to original Medicare, but it's not effective till day one of June.
The next month, yeah.
You know, so it'll catch you later. We catch a lot of people. I've saved with this for so many years, and now I don't know what to do. So just be careful later on
Yeah.
when that happens, if
That-
that happens.
And that's the institutional open enrollment that I touched on briefly, is that ability, if you're in an institution, to drop back to Original Medicare.
And if you drop out of the supplemental, the gap insurance,
Mm-hmm.
and you move to an Advantage, you may not be able to get back into it as
Exactly.
well, because,
Exactly.
you know, once you change,
Mm-hmm.
they don't have to accept you back.
Exactly, and that goes back to what I was mentioning with Medigap plans, is they can, if you miss that initial enrollment period to pick up a Medigap, they will most likely age rate you. Now, if you look at the community rating, you might get a break, because again, they're not looking at you as an individual, but a lot of plans will say, oh, you know, sorry, now you've dropped out and I'm going to apply these.
When you're 65, though, they can't say no to you.
They can't say no to you when you're 65,
They have to accept you,
yes.
but then after you change to something else, then they can say, I don't.
Yep. And that's an important point that I didn't make, actually. One of the advantages of Medicare Advantage is if you are younger than 65 and you're disabled, you can enroll in a Medicare Advantage plan because they cannot health screen you. Most supplemental plans under age 65 will not accept you, bottom line, or they'll charge you an arm and a leg. Medicare Advantage plans can't do that, so oftentimes younger, under age 65 people who have Medicare will find it more advantageous at that point to be in a Medicare Advantage plan. But once you turn 65, you could switch and enroll in a supplement, and they can't screen you then at that particular point. So if you probably had a chance to read about what should I do to join a Medicare Advantage plan, here's just some of the things to consider. And I'll put in a plug again for the state health insurance and assistance programs. If you Google your state and put in like PA SHIP, it'll come up with what is now called PA Medi. I think it's called Shine in New Jersey. So I don't cover New Jersey, unfortunately. But so there's these local one-on-one counselors. You call the 800 number and you can meet with somebody. Typically it's run through the county offices on aging. So they're not all that far from you either, where you can sign up for this one-on-one assistance to get some help and work through some of these questions. So I did want to talk about Birdshot uveitis also here, and while I'm putting in a plug for the SHIP program, I also want to say that Medicare offers all of our publications in various formats. So if you need something in large print, Braille, readable, like machine readable, any of those formats, we have a special program where if you call 1-800-MEDICARE and say, I need X publication this way, they can put in that order for you and have it mailed to you. For example, every year, every household gets a copy of the Medicare and You handbook. It's shipped one per household every year at the end of September. And so if you need that in large print, if you need that in some other accessible format, you call 1-800-MEDICARE and ask for it to be sent to you in that accessible format. So we have that for you, and I want to make sure I put in a plug for that. So related to Birdshot uveitis, these top 6 codes that you see there, far and away were the top 6 codes that were billable. And you can see that they were accounted for 43% of all the claims, and that basically there was a denial rate of only 3.9%. And of those denials, the vast majority of those were duplicate claims. So for these diagnoses codes, Medicare is paying for them. This is original Medicare, let me say that. This is original Medicare claims. We don't carry claims data for Medicare Advantage plans. So I do not know what their payment rates are for their particular claims. But I wanted to let you know from a comfort level, original Medicare in our experience through Novitas, which covers 14 jurisdictions, a big chunk of the United States, including Pennsylvania and all the mid-Atlantic states, is paying a vast majority of these claims. And this is lastly, if you like me, give me a good rating. We're required to do this for all of our presentations. And so I'll just leave that up for a second if you want to scan the QR code. If not, that's totally fine because I enjoyed being here. I love answering questions. I want to make sure that everybody can access their benefits the best way possible. It's just been one of my passions forever. So if you have, I'm happy to stay afterwards and answer any individual questions you might have. I did not put my contact information on here, which I realized, but my name is Sharon Graham, Graham. I will send it along perhaps to the organizer here to include with the slides perhaps. My agency, Centers for Medicare and Medicaid Services. And so if you just Google Sharon Graham and CMS, you probably come up with me, or at least the phone number for our office, which is right over here at 8th and Market Street, so we're pretty close by. And we cover the mid-Atlantic states, but if you live outside of Pennsylvania, Delaware, DC, Maryland, Virginia, West Virginia, I have colleagues all across the country in 10 different offices and can put you in touch with somebody there too.
Put the T-Rex in the QR code.
I know, somebody with a sense of humor, right? Is Medicare antiquated?
That's a Medicare humor, is it?
Exactly, I know. I thought the same thing. But that's it, yeah. All right. Any other questions I can answer right now? Yes.
We happen to be from Wisconsin, so we'll be in that special bucket. We can find information on our state site.
Yes. On the Medicare Select plans, yeah, definitely. Or again, Wisconsin SHIP, State Health Insurance and Assistance Program. I don't know what it's called in Wisconsin, but they would have people right in your county, I'm sure, who can counsel counseling, yeah. Mm-hmm.
Wonderful, thank you.
You're welcome. Yes?
For the Part D prescription, do you still have to deal with the donut?
Yeah, the donut hole actually, as a result of the Affordable Care Act, is going away. There is a coinsurance now, but for people who don't know, Medicare Part D, when it was originally set up, there was the basic benefit was a deductible, then there was a cost-sharing piece, and then when your out-of-pocket costs hit, I think it used to be like around $2,000, you paid 100%, until your out-of-pocket costs were basically about $5,000, and then you were in the catastrophic phase. So if you have high-cost prescription drugs, there was a big chunk of dollars you were having to pay in this donut hole. So you can imagine, here we got coverage, big gap, and then you paid again. So with the Affordable Care Act, the donut hole gradually went away. So now basically, there's still coinsurance, but the coinsurance that is basically flat all the way until the point in which you hit catastrophic coverage. And now, as a result of the Inflation Reduction Act, even that cost sharing is going away starting next year. And in fact, next year with the Inflation Reduction Act, your out-of-pocket cost for all prescription drugs will be capped to $2,000.
So say somebody's on Humira.
Yes, for prescription drugs. Mm-hmm.
So
Yes. And in fact, so in next year too, for high-cost drugs, Inflation Reduction Act, I'm going to give it a shout out because it does a lot of great things for Medicare. There is going to be called the Medicare Prescription Payment Plan, which will basically, rather than having to pay for like $2,000 in January, you can spread that out over 12 months.
We're taking a vacation.
Yeah, no, I'm telling you that, like that, again, the Inflation Reduction Act, your out-of-pocket costs will be capped at $2,000 starting next year. It's the reason that insulin drugs are $35 now. That started last year already. That was the Inflation Reduction Act. And the fact that you can pay your premium, your out-of-pocket costs over 12 months, that starts next year. And as you may know, we're negotiating drug prices now finally. Granted, only 10 drugs, but those negotiated prices will kick in 2026. And then the numbers of drugs grow every year. It's 10 drugs in 2026, 10 drugs in 2027, and I think it's 15 every year beyond that. And so we finally have started negotiating drug prices too. Yeah, so that's great. Inflation Reduction Act. Mm-hmm.
Cool.
Thank you.
Yeah.
Thank you.
All right, there you go. Have a nice day.